It's going to be a busy weekend for patients, families, and staff at Gundersen Health System as they prepare to move into the new hospital on Sunday.
News 8's Brittany Schmidt joins us now to show us what it takes to move an entire hospital. Brittany?
For the past couple of weeks, staff members have been preparing to move into the new Legacy building. They definitely have their work cut out for them as they move equipment, supplies, and more than 150 patients without interrupting their level of care. It's been a work in progress, but staff members have a plan in place to make it a smooth transition for everyone. It's been a year in the making.
We're ready for this. We've prepared for this for a really long time.
Jan Dehan, a hospital administrator at Gundersen, says it's finally time to put the plan to the test.
It's really not that complicated. It really just is a consideration of what does that patient need. We move patients every day, and we do that safely and respectfully.
But now the patients will be moving into an entirely new building, which takes a little more practice. Operational Project Manager Mason Quackenbush says each patient has a specific plan.
We've got a pretty extensive plan for those patients if they require a physician to go with, additional nursing staff.
First, the patient will prepare to move.
After that, when we have a move scheduled for a certain time, the patients will be ready to go at that time.
That will include equipment, supplies, and personal items. Then a move team will be deployed.
That'll include a transporter and then the nurses and staff on the unit.
A specific route is planned, and an advance team will be sent out to make sure the hallways are clear for the patient.
If we're moving a patient, there's not going to be someone popping out of a corridor, there's not going to be a garbage can in the way, the doors aren't going to be closed.
To make sure the patient makes it to the room safely without any delays.
We make it to the new building, and then there's a check-in process.
Once that patient is checked in, the next patient will be sent over. But administrators admit you can't plan for everything.
There isn't any scenario where you can have all the answers in advance. But we have people who make critical decisions every day, and that is what we're going to do on Sunday.
On Sunday, the move will happen in 3 phases, beginning at 4 in the morning. If everything goes as planned, administrators say patients from every department will be moved in by about 1 in the afternoon.
Thanks, Brittany. And just a reminder, the hospital will remain completely operational during the entire move, meaning they will still be accepting patients at any time.
Once everyone is moved into the new Legacy building, the old part of the hospital will be cleared out and renovated. Here's the plan. After emergency services moves, the first floor will be reconfigured and used as a place to store all of the imaging equipment. As soon as the operating rooms on the second floor are vacant, they will be renovated and then used as an extension of the operating rooms from the new building. There will also be open spaces to store extra equipment and supplies.
We've got an extensive plan to figure out how do we get rid of the other stuff, whether it's a donation, sale, whatever it might be, but we're going to use as much stuff as we can.
Many of the spaces will remain empty until hospital administrators decide how to fill them.